Hello, my friends. I'm Dr. William Harris. After more than 30 years sitting across from patients just like you, men and women in their 50s, 60s, 70s, I've learned one truth. The numbers on a blood pressure monitor can be confusing, even frightening, when no one explains what they mean. Let me ask you this. Have you ever been at the doctor's office, the cuff tight on your arm, the machine beeping, and the nurse says, "Your pressure is low," but then you're left wondering, which number is she talking about? The top one, the systolic, or the bottom one, the diastolic? And does it even matter which one it is? I remember a patient of mine, Mrs. Green, who once told me, "Doctor, my systolic was under 90 yesterday, and last month my diastolic was 55. Which one should I be more afraid of?" That simple question carries so much weight because each number tells a very different story about your heart's health. Think of it this way. Your systolic pressure, that top number, is the push, the force of the tide crashing onto the shore. It shows how strong your heart pumps blood out into your body. If that force falls too low, your brain, kidneys, and even your own heart may not get enough blood in that moment. That's when you feel dizzy, faint, or worse. Now your diastolic pressure, the bottom number, is quieter. It's the calm water between the waves. That's the time your heart actually receives its own nourishment. If the number drops too low, your heart muscle might not get the oxygen it needs during its rest phase. And over months or years, that slow deprivation can wear your heart down. I want you to imagine this. Your heart is not just a pump. It is also a sponge. With every beat, it pushes blood out. But in those quiet pauses, it soaks up life-giving oxygen. If the pressure is too low during that pause, the sponge stays dry, and a dry sponge can't stay strong forever. So here's the question that keeps people awake at night. Which is more dangerous, low systolic or low diastolic? One can strike you suddenly, like a storm tearing down a tree. The other can weaken the roots slowly until one day the tree falls without warning. Stay with me, because in today's conversation, we're going to uncover the real risks behind these numbers, what they truly mean for your heart health, and most importantly, what you can do about them. I'll share stories from patients, insights from decades of practice, and simple steps you can take starting today to protect your heart for the years ahead. Now let's dive deeper into this question that so many of my patients ask. Doctor, which one is worse, low systolic or low diastolic blood pressure? To answer, we first need to remember what blood pressure really is. It's not just two numbers written on a chart. It is the story of how blood moves through your body, the rhythm of life itself. Your systolic pressure, that top number, shows how hard your heart is pushing blood out when it contracts. If this number drops below 90, we call it low systolic. And when that happens, it often means your heart isn't pumping forcefully enough. Imagine the water pressure in your home suddenly dropping. When you turn the faucet, only a weak trickle comes out. That's what happens inside your body. I had a patient named Robert, 70 years old, who came to me after fainting while mowing his lawn. When we checked, his systolic blood pressure was just 82. His heart wasn't able to keep up with the demands of his body. That kind of low systolic number can be an immediate danger because without enough pressure, your brain, kidneys, and other vital organs aren't receiving the oxygen-rich blood they need. That's why low systolic can feel so dramatic. Dizziness, fainting, even collapse. On the other hand, your diastolic pressure, the bottom number, reflects the resistance in your blood vessels when the heart is resting between beats. If this number drops below 60, we call it low diastolic. At first glance, it might not seem as scary. After all, you might not collapse right away. But here's the hidden danger. It's during this quiet phase that your own heart muscle receives blood flow. If the pressure is too low, your heart isn't getting enough nourishment. Over time, this can increase your risk of heart attack, heart failure, or simply wearing out the heart too soon. I think of another patient, Mrs. Lopez, 66 years old. Her readings looked normal to her, 120 over 55. She didn't think much of it, but she kept complaining of fatigue, shortness of breath, and mild chest pressure. When we look closer, her low diastolic pressure was starving her heart muscle during those rest phases. It wasn't a dramatic emergency, but it was a silent threat, slowly carving away at her health. So which one is worse? Well, it depends. Low systolic pressure is usually more dangerous in the short term. It can put your life at risk in minutes or hours if not treated. Low diastolic pressure is more dangerous in the long term. It can quietly damage your heart over years. Both deserve attention. Now let's talk about what you can do, starting today, to protect yourself. These are not complicated steps. They are simple habits, but I've seen them transform the lives of countless patients. First, hydration is everything. Dehydration is one of the most common and overlooked causes of low blood pressure. As we age, our sense of thirst becomes weaker. Many of my patients tell me, "Doc, I don't feel thirsty, so I forget to drink." But by the time you feel dizzy or lightheaded, your body's already running on empty. Think of your bloodstream like a river. Without enough water, the river dries up and the pressure falls. A simple habit, drinking 8 to 10 glasses of water daily, can keep your blood volume stable and prevent dangerous drops in pressure. Second, your diet plays a bigger role than you realize. People often assume diet only affects high blood pressure, but it matters just as much for low blood pressure. Eating balanced meals, plenty of vegetables, lean protein, whole grains, keeps your blood vessels strong. And for those prone to low pressure, adding a little more salt can sometimes help, but always under medical guidance. One of my patients, Mr. Daniels, found that by spreading his meals into 4 smaller portions instead of 2 big ones, he no longer experienced those sudden dizzy spells after eating. Large meals can pull blood into your digestive system, leaving less for the rest of your body. Small, frequent meals keep things steady. Third, regular monitoring. This is the habit I wish every one of my patients over 60 would adopt. Don't wait 6 months for your next doctor's visit to check your blood pressure. Invest in a reliable home monitor. Write down your readings, note how you feel, and bring that log to your appointments. I had a patient who kept meticulous notes for 3 months. When we reviewed them, we discovered patterns linked to his medication timing. Adjusting his dosage solved a problem that had plagued him for years. Knowledge truly is power when it comes to your health. Let me pause here and ask you, have you ever brushed off dizziness as just getting older? Or ignored fatigue because you thought it was part of aging? I'm here to tell you, those are not just signs of age. They are signals. Your body is whispering that something is wrong. And if you listen closely, you can act before it turns into a shout. Beyond these 3 habits, there are other important steps. Moving your body daily, rising slowly from bed or a chair, wearing compression stockings if recommended, and always talking to your doctor before making changes to your medication. None of these are dramatic measures, but together they create a shield around your heart. Think of it this way. Your blood pressure numbers are not enemies. They are guides like signposts on the road. If you ignore them, you may end up lost or in danger. But if you pay attention, you can steer your life toward health and longevity. In my decades of practice, I've seen people recover strength they thought they had lost forever, simply by respecting these numbers and making small, consistent changes. You have more power than you think. So, my friends, here's what I want you to carry with you. Blood pressure is not just a pair of numbers your doctor rattles off. It is a window into the strength, the resilience, and the future of your heart. When your systolic number runs too low, it can be like a sudden storm. Your body feels it right away. Dizziness, fainting, even collapse. It's a short-term emergency that must never be ignored. When your diastolic number drifts too low, it may not feel as dramatic in the moment, but it is like slow erosion, silently starving your heart muscle of the oxygen it needs. That is the long-term danger. Both numbers matter. Both deserve your respect. I want you to imagine your heart again, not as a machine, but as a faithful companion. It has never once taken a break. It has been beating for you every second since the day you were born, over 100,000 times each day. And now it asks for a little care in return. That care looks like hydration, balanced meals, gentle movement, steady monitoring, and conversations with your doctor. None of these steps are impossible. In fact, they are small gifts you give to yourself every single day. One of my patients, Mr. Reynolds, once said, "Doctor, I thought my best years were behind me, but after I started tracking my blood pressure and making small changes, I feel like I've been given a second chance." That is the power of listening to your numbers. That is the power of respecting your heart. So here's my challenge to you. Don't wait for a crisis. Don't wait for the storm or for the slow erosion to win. Start today. Take a sip of water. Go for a short walk. Check your blood pressure and write it down. Share your results with someone you trust. These are not just routines. They are acts of love toward yourself and those who care about you. And now I want to hear from you. Have you ever experienced low blood pressure? What did it feel like? And what helped you recover? Leave your story in the comments below. You never know who might be encouraged by your words. If this video gave you clarity, please hit that like button so more people can find it. Don't forget to subscribe to the channel and tap the notification bell so you never miss a message that could protect your health. And if you know a friend or loved one who struggles with blood pressure, share this video with them. It might just change their life. I'm Dr. William Harris, and from my heart to yours, I wish you peace, strength, and many more years of vibrant health. Until next time, take care of yourself and take care of your heart.